morning, my name is Linda Dean. I'm a senior lecturer in child nursing and I'm also the recruitment lead for healthcare courses. So thank you very much for coming to listen to my presentation. So today I'm going to talk about adult nursing, child nursing and mental health nursing, all of which we run at the University of Bedfordshire. So the BSc in Adult Nursing runs at the Aylesbury, Bedford and Luton campus, and that course runs from October only. We run the BSc in Mental Health Nursing, which runs at the Aylesbury and Luton campus, and we run the BSc in Child Nursing, which runs from our Bedford only campus, and that course also starts in October. The MSc in Adult Nursing runs in Luton, that course starts in January, and the MSc in Mental Health Nursing also runs from the Luton campus and starts in January. And please note that the MSc courses are taught in Luton, but placements are available in Bedfordshire or Buckinghamshire, so you can choose where you would like to do your placements. So the courses are validated by the Nursing and Midwifery Council, and our course aim is to make you fit for practice at the point of registration. And you're taught throughout the course by a range of people, so you are taught by academic tutors, professors, practitioners. We have very close relationships with our practice areas, so staff can come in and teach you according to their speciality. And also you could be taught by members of the public. We use service users within our curriculum who are often experts in their care, so they will come and talk to student nurses about their experiences and what they would like to see in a student nurse. Students are encouraged and supported to participate in all areas of university life. And very much it's a journey of growth and discovery, so you will be surprised how much you develop as the course progresses. So Adult Nursing. Adult Nursing is the course for which we have the most places within our nursing courses. And as I said earlier, Adult Nursing runs in Luton, Aylesbury and Bedford. So when we interview you, we will ask you which campus you would prefer to be based at. You will be caring for patients from the age of 16 right the way through to elderly patients. And the nursing course is very much person-centred, so very much focused on your patients and how to give them the best care. When you're a student nurse for adult nursing, you'll be undertaking a range of placements. Some will be in the community, some will be within the hospital. But the ultimate aim is to make you fit to practice at the end of the course. So you could be working on a variety of wards, you could be working with a community nurse, you could do placements in intensive care, placements within the National Spinal Injuries Centre, placements in accident and emergency, so that at the end of the placements, at the end of the course, you have done a range of placements and the NMC will consider you fit to practice as a qualified nurse. Child nursing. So as a child nurse, you could be caring for children from the age of 0 right the way through to 18, maybe 19 years old. So it's not all about tiny babies, it's not all about toddlers. You will be caring for some children with complex needs. Your placements could include neonatal units, children's hospices, children's wards, accident and emergency, health visiting, children's community nurses. But it's very much family focused. So although it's child centred, we're almost also looking at how we would support the family. Mental health nursing. As a mental health nurse, you will be caring for people of all ages with mental health conditions. So in this country we have a number of young children with mental health conditions, but right the way through to elderly care. And these could be patients with dementia, drug and alcohol problems, acute mental health problems. Much of mental health nursing takes care within the community, so you could be working in clinics, visiting patients in their own homes, and also participating in transitional care and patients within the hospital setting. Just to mention the MSc, which is running at the moment in adult and mental health nursing, and we are currently developing an MSc in child nursing as well. And these courses are aimed at people with a previous health-related degree at a 2-2 or above, and 600 hours of direct patient care as a minimum. Some people may have a degree that isn't healthcare related, and we may consider you, but you would need to have more than the 600 hours experience of patient care. It's a 2-year full-time intensive course, and the course comprises of theory and practice, but it does give you a dual qualification at the end as a registered nurse in the field of nursing you've studied, and also that MSc degree. The course is very much based on the NHS Constitution from 2013. On the left-hand side of the screen you have the key principles. On the right you have the core values, and this is what we are looking for in our student nurses. So it's all about being a healthcare professional, treating your patients with respect, giving them choices, making that commitment for the course, treating everyone with compassion. You'll hear members of staff say it often, but if you think about when you're giving that nursing care, how you would like your relatives to be treated, and you follow that instinct of how you would care for your relatives, then you won't go far wrong. But also we're looking at improving our patients' lives and treating everybody the same. Everybody counts. So simulation and skills, this is quite a big part of your course. So when you initially start the course, some of you may have experience within practice areas, but some of you may never have been near a patient before. So it's really important that you learn to carry out those skills in a safe environment. So how to do blood pressures, how to do simple wound dressings, how to give injections, how to carry out personal hygiene for your patients. So all of these things will be taught in simulation, and you can see this is actually our Luton simulation lab, but you can see they're set up as hospitals so that you can gain the experience you need. And all of our campuses, Aylesbury, Bedford and Luton, have skills facilities for you to gain confidence before you go on to the wards. So the BSc is a 3-year full-time course. The course is half practice and half theory. Practice will include ward and community placements, and theory partly will be coming into the hospital and into the university to study, have lectures, but also some of the study will be self-directed at home. So there is an expectation that as you progress through the course, you will gain confidence and you will be able to self-direct your learning more. You would be expected to travel to practice locations. I'll show a couple of maps in a minute that show where you may be doing your placements. So we do need to know whether you have a car, whether you would be prepared to use it to get to placements. But if you don't have a car, then we will be able to make sure that your placements are accessible by public transport. You may be, or you will be required to work shifts within the course, and that will depend on where your placements are. So if you are doing a ward placement that's open 24 hours a day, it's open at weekends, then you would need to be prepared to do shifts to match your supervisors. Your supervisors you're working with within placement to make sure that they can teach you and give you the support you need. So it really is in your interest to work shifts to try and match those of your supervisors. It might not always be shifts. Some of the placements will be Monday to Friday. If, for instance, one of your placements is in outpatients department, they wouldn't be open at weekends. So you would be doing your hours within the week. You get a holiday within the course, and we would tell you when your holiday is at the beginning of the course. So can't really change your holiday unless it's exceptional circumstances. So you get time off at Christmas, time off at Easter, and you do get time off within the summer. So, and there are obviously things like exam weeks, assessment weeks where you are able to study at home if you want to. So 3 campuses for our nursing courses. So Luton campus is in the centre of Luton, and that's where we do adult and mental health nursing. The Aylesbury campus is unique in that it is actually placed on the Stoke Mandeville Hospital site, so very, very close to the practice areas. And there we do adult and mental health nursing. And then on the right you can see the Bedford campus, and that's where we do adult and child nursing. So just to put those into context on a map, we have a map of Bedfordshire here, and you can see Luton is right down at the south of the county. The campus is in the middle of Luton, and the Luton and Dunstable Hospital is just between Luton and Dunstable, and it's right next to junction 11 of the M1. So very accessible, and you can see that it's about 3 miles from the Luton campus to Luton Dunstable Hospital. Then moving up the map, you can see Bedford towards the north of the county, so that's where the Pole Hill campus is, and that's our Bedford campus, and that's also quite close to Bedford Hospital. And if you choose to be based at Bedford, then for adult nursing, most of your placements will be at Bedford Hospital, but your community placements could be in the surrounding area. If you choose to study child nursing in Bedford, then your placements could be at Bedford Hospital and the Luton and Dunstable Hospital, and there is the option of placements within Buckinghamshire as well. So Buckinghamshire, if you choose to come to the Aylesbury campus, you can see that Aylesbury is in the middle there, and that's where Stoke Mandeville Hospital is, and that's where the campus is based. And you could also be doing placements at High Wycombe towards the south of the county, Amersham, and we also have limited placements available at Milton Keynes. So what do we need from you? Well, following a successful interview, we would ask you to achieve 112 points overall. We do accept A-levels, BTECs, access courses, and some people may have other courses that you've done which would also match our requirements. You need GCSE English and Maths at grade 4 or above. We don't ask for a science GCSE for our nursing courses, but we would also consider functional skills. If you don't have GCSE English and Maths, we will consider functional skills level 2 for numeracy and literacy. So if you haven't yet applied to us, do please apply via UCAS. Please make sure that your personal statement applies to the type of nursing you are looking to study. We want to see that you understand what you are applying for. And the next stage will be an interview invitation. At the moment, we are interviewing via Skype. And in that interview, we're looking at how you communicate and your behaviours, whether they are given the potential to be a student nurse. And that would be an individual interview. We don't do group interviews for nursing. We also need a satisfactory reference. We would also ask for a DBS from you before you start the course, and you would need to have an occupational health check. And that is really in your interests. It's purely so we can give you the support that you might need. Lots of our students do have various health conditions. It's not so that we can say you can't do the course, just so that we can make sure you get the support you need. So lastly, why choose us? Well, we have relatively small numbers of students, and that means that our students are well supported in both placements and theory. We were granted a Silver Award in our TEF, and all of those students who wanted jobs at the end of the course, those who have successfully completed the course in 2019, they got jobs, and many of our students get offered 2 or 3 jobs. Many students choose to stay and work locally in the hospitals where they've done their practice, but also students can, once you're qualified, really you can work anywhere in the UK. And once you finish the course, you may want to continue to study, and there's lots and lots of post-qualification opportunities. And there are scholarships available, could be up to £2,400, and that depends on the qualifications you're coming in with. So that is the end of the presentation, so thank you very much for listening.